So I'm a board certified psychiatrist and have helped over 200 PMHNPs gain clinical confidence in their psychiatric diagnosis skills, treatment skills, and actually helping their patients get better. So this video, you're going to learn about how to become an outstanding psych provider. And I'll share with you 5 things that I consider that outstanding psych providers have that the average psych provider does not. And so number 5 is scientific knowledge. And there are levels to this. For example, so to become a psychiatrist, first I had to go to medical school, then I had to go through residency, then I did my child and adolescent fellowship. So that's 9 years of training, lots of board exams and things on the way. But from that, I've amassed a huge deal of scientific knowledge, understanding the biophysiological foundations, like understanding molecular stuff, understanding cellular things, chemistry, biology, understanding how medications work, understanding how therapy works, understanding how to deal with complex cases. From all of this, I've amassed a lot of scientific knowledge, and that's why people come to me as a psychiatrist for my expertise, both patients but also other psychiatric providers. That's why they come to me. And so a lot of people unfortunately don't know that their knowledge may not be where it needs to be. And so this is especially common in the NP community because oftentimes you don't know what you don't know. So you might not, you go through school and you expect to be learning a lot. And then it's only till you start your first job and you realize, wait, I didn't learn anything in my preceptorship and my clinicals. Like that didn't teach me enough to be my own provider. Like this was absolutely nothing. And so that's why a lot of NPs, for example, come to our coaching program because they want to really understand and level up their scientific knowledge, understanding how medications work, what the half-lives are, when is it appropriate to use certain medications, not how high of doses can you go to, is it acceptable to go then higher doses. So that's where having an experienced provider teach you can really make a difference. So scientific knowledge is very, very key. And then, all right, like MD versus P, right? And so that's why there is a difference in the education. And so that's why now it's my mission to help NP so that way you can practice with confidence. So then number 4, kind of leading into this, is integrative psych. So nowadays, patients don't want just medications anymore. Like may have been true back then, but now patients really want the integrative experience. So what does this mean? So this means supplementation. This means hormonal. So I'll say hormonal, nutritional, gut, labs. So a lot more detailed stuff than normal. So they want supplements, hormonal, nutritional, gut labs. They want more therapy or coaching. They want lifestyle, like diet, sleep, all the things. So they want all that. They also want genetic testing. They want more psychological testing. So basically, and this is all stuff that I do in my integrative private practice. And so it's because now patients want a higher, more concierge level type of experience, but they also want more in-depth work. So imagine just like giving a medication for a patient, but versus like starting them on supplements that can help them, evidence-based supplements, which there are some, by the way. Especially when I was going through medical training, I was taught that, okay, supplements, waste of time, don't really bother with them. Like basically I wasn't taught that at all in med school, residency, fellowship and stuff. And it's only once I got out of that I started to learn more about integrating supplements into general care. Therapy and coaching, we can utilize a lot of therapy techniques and coaching techniques in our medication management sessions. So teaching someone about CBT or doing a supportive intervention, helping them realize like a unresolved conflict they might have. That can also help us. Doing hormonal testing, nutritional testing. I can't tell you so many patients who've gotten better because we corrected their vitamin D deficiency or their magnesium deficiency, or I started them on fish oil supplements. We had a thyroid problem or testosterone problem, etc. So many people have gotten better because we prioritize their diet and their sleep. Like I have this one patient who's lost like 15 pounds because now he's tracking his diet, he's tracking what he's eating. And lo and behold, he's noticing that he's getting better. Therapy and coaching, as I mentioned, incorporating exposure elements like for anxiety into their treatment. So this is huge, and I think is really important, and separates an outstanding or an excellent psychiatric provider from just your mid one. So then we have number three, and number three, and this is more for you, is emotional boundaries. A lot of people say they can't do psych because the content is too much, or like, the stuff that patients would that they go through would affect them. For example, I remember when I was psych resident, I used to have med students working with us, and we are just casually talking. I was this one girl, and she said that she couldn't do psych because like she would take the people's pain too much, and like it would affect her. And I was like, oh, that's curious, because for me, I felt like that was never a concern that I had. Because for me, like I make sure I have really good emotional boundaries, meaning that if a patient's going through something, I can be empathetic and caring for them, but the patient's problem is not my problem. Whatever their life is, right? Whatever their situation is, whether it's like an abuse kind of situation, or they feel miserable about something, or they're hallucinating schizophrenia, or they've spent 10 grand on from their bipolar manic episode, whatever it might be, I can feel for the patient, empathize with them when they're there, but their issue is not my issue. So their issue should not affect me emotionally. And people might say this is callous or makes you a bad provider, but I disagree. I think it makes you a good provider, an excellent provider, because now I can still see other patients now. I'm not getting burned out, I'm not getting overwhelmed, and I'm staying cognitively sharp, so I can still utilize my rare skill set to help out other patients. Whereas someone who gets burnt out by not having good boundaries emotionally is going to be worse, because they won't be able to see as many people as I do, or help everyone else as impartially as I am able to do. So very, very key. And it's something that some people may have to prioritize more than others. But just remember, you can help the patient in the moment, but once you leave, like their problem is not your problem. So you don't need to spend time thinking about it. And I remember like I felt like I'd really mastered this when I had a patient who I was taking care of, an adolescent patient who had unalived themselves after they stayed with us inpatient, and we found out a month later. And people were asking me like, hey, are you fine? Are you okay? If you ever want to talk, let me know. This was my first patient that I ever had that had done that, but I was fine. I cared for the patient when I could, when she was inpatient, but whatever happened after that happened, right? And I don't need to lose sleep over this happening. It doesn't change the outcome. So very important to internalize that and to not feel guilty about that either. So number two is establishing rapport with the patient. So we know that out of all the factors that influence how much a patient gets better, especially in therapy, therapeutic alliance is probably like one or two in terms of importance. And so the same concept apply for our med management sessions as well. If the same patient goes to two different providers and both providers give the same intervention, let's say Zoloft 50 milligrams, but the patient likes provider A more than provider B, they're automatically going to get better from provider A. Even though it's the same intervention, this doesn't apply to other fields of medicine. The patient could hate the provider versus like the provider. If they have an infection, they take the antibiotic for the same course of days, they're going to get better. Or if they like one surgeon, but they don't like one surgeon, but the surgeon does, they're both excellent surgeons, then the patient's they're going to have pretty similar outcomes. But for us, for psych, it's different, because a lot of our symptoms are subjective. Depression, anxiety, how you feel, et cetera, et cetera. So by developing a good rapport and alliance with the patient and prioritizing that, you're actually helping your patients get better. They'll stay more compliant with their medication. They're willing to stick it through with you, even if that patient fails a couple of treatments. They'll have a positive kind of a halo effect. They'll have a much more positive regard of themselves, their self-esteem, how your treatment is impacting them. You also provide a safe holding environment for them to kind of mature and grow up in, right? Especially for people who have a lot of attachment disorder issues. So it's super, super important. Like I can't understress how important the alliance building really is. And then number one is a growth mindset. An outstanding provider is always learning. They're always humble and they always understand that there's so much that they don't know. Even me now as an attending, like there's still so much. I forget stuff all the time. Like I forget, oh, how does this medication work? Like what's the dose here? I got to look this up. Or man, there's this new med coming out. I have no idea about this thing. Or I've never actually used this. I've never prescribed this in practice, but my PMHNP students are asking me about this med. Crap, I got to go learn it and understand it. Using more supplements, get running into patients where I'm like, okay, I don't know what to do here. So I need to look at the literature. I need to ask other clinicians. All this stuff, like the integrative stuff, I learned after I finished residency and fellowship. So the point is that I'm always learning. And so any outstanding provider knows that they're always learning. A poor provider gets arrogant, and they get arrogant in their psychiatric knowledge. They feel like, okay, they kind of got it, or they might stay stagnant, or they just prescribe the same thing over and over again, or they don't really listen to other people's feedback. And so this is a problem. So a lot of MDs, they don't like NPs for various reasons. And one of those reasons is that they feel that they're too arrogant. They feel like, oh, they just come in and they just, without any training, and they just kind of know everything. Or, they're prescribing and they feel like they know stuff. I don't think that's true. The NPs that I've worked with have been very wanting help and wanting to learn and grow their skill set, which that's the kind of person that I want to work with anyway. But the point is that, and plenty of MDs fall in this growth mindset too, or in the fixed mindset where they have their medications that they do, they just kind of go into work, clock in, clock out, and then that's it. So point being is that you always have to be learning. And that's what's going to separate you from even the best basketball players, whatever, sports players, whatever's always learning. The best athletes, right? They're all continually improving their craft. And more importantly, the best athletes, right? They all have coaches. It's not like the average person who has a coach. It's the best. So if the best people have coaches, why aren't we the same thing? Coaching, coaches. The best people are constantly learning from other people and then not having that arrogance that they don't know everything. And so that's why a lot of people join our PMHNP community as well, is because they want to level up their psychiatric knowledge so they can get patients better and they can treat patients better. And so, yeah, these are the 5 things I think make an outstanding psych provider. And so you definitely want to try incorporating these into your practice. And yeah, I hope this video was helpful, and